aggressive drug. So, for its drug discovery, in 1960s, Boehringer Ingelheim planned to synthesize a peripheral adrenergic compound for nasal decongestion. It is in the form of simple nasal drop. He planned to substitute two chlorine groups on the phenyl group of imidazoline, which caused the compound to become more lipophilic, hence it could penetrate the blood-brain barrier. However, the developed drug has shown a high vasoconstrictive and decongestive effect. The administered drug shows a lowering blood pressure with its bradycardia and also the dryness of the mouth. In 1966, the clonidine is being marketed for its new indication instead, which is blood pressure lowering, under the trade name of catapraz. The discovery of the clonidine leads to more research on it, which is the central alpha-adrenergic receptor by the chemists, pharmacologists, and also the physicians.
The medicinal chemistry of clonidine. Alpha-2 receptor mechanism. The alpha-2 receptor consists of G protein coupled receptor. The clonidine binds to the alpha-2 receptor at the presynaptic neuron. The binding of clonidine causes the inhibition of adenylyl cyclase that will lowering the level of intracellular CAMP. Thus, the production of the catecholamine in the body will be low. Penetration of blood-brain barrier. Clonidine acts at the alpha-2 receptor at the brain. The presence of amine groups increases the polarity of the drug. Therefore, clonidine needs a transport protein to pass through the blood-brain barrier. Structure-activity relationship. When we zoom into the structure of the clonidine, we can see that there are two amine groups in the structure. The amine functional group is important because it interacts with the binding region of the alpha-2 receptor through hydrogen bonding.
The presence of double bond in clonidine structure restricts the bond rotation and increases the rigidity of the structure. Besides that, the imidazole ring in the clonidine structure plays an important role as it binds to the imidazoline receptor 1 at medulla oblongata. Furthermore, the steric hydrogen on the bulky group of orthochlorine group does not permit the coplanar conformation of the two rings. So we can say that the both chlorine prevent the two rings to exist on the same planar. For the clonidine isomer, the uncharged form of clonidine can exist as a pair of tautomer due to existence of NH bridge. So we can say that the nitrogen can form a double bond with the neighboring carbon.
Next, how does clonidine work? Clonidine binds to and stimulates central alpha-2 adrenergic receptors, thereby reducing the amount of norepinephrine release and thus decreasing the sympathetic outflow to the heart, kidneys, and peripheral vasculature. The reduction in sympathetic outflow leads to decrease in peripheral vascular resistance, and then it decreases the blood pressure, and eventually it will decrease the heart rate. In addition, clonidine also binds to imidazoline receptor subtype 1, I1. The activation of I1 receptors decreases the sympathetic tone via central mechanism. It has hypotensive effect and contributes to a reduction in blood pressure.
Sawadika. Next, we are going to talk about the main clinical indications of clonidine. Firstly, clonidine is used to treat hypertension. This is because clonidine can decrease heart rate and relax the blood vessels so that it can make the blood to flow more easily through the body. It can be used alone or in combinations with other antihypertensive medications, and it is available in oral and transdermal pages. Secondly, clonidine is also used in patients with ADHD. ADHD is attention deficit hyperactivity disorder. Patients with ADHD have difficulty in focusing, controlling actions, and remaining still than other children who are at the same age. Clonidine extended release tablets may treat ADHD by affecting the part of the brain that controls attention and impulsivity. It is used in pediatric patients as monotherapy or as adjunctive therapy to a psychostimulant. It is available in oral and transdermal patches. Thirdly, clonidine is also used to treat severe pain in cancer. It can be used when the pain is not adequately relieved by opiate analgesics alone. It is also used in post-operative patients in combination with opiate analgesics, and it is only available in epidural dosage.
Okay, next, we will move to the next part, which is the adverse effect of clonidine. Generally, the use of clonidine for the treatment of hypertension may lead to several short-term and long-term effects due to its action as the alpha-2 agonist drug. So, for the short-term effects, clonidine may cause drowsiness, dizzy spells, constipation, and drying of the mouth. This is due to the sedative effect of the drug and its action on the salivary glands. As for the long-term effect, the patient may experience fever, headache, fatigue, and general weaknesses. And for the cardiovascular system, it may cause heart palpitation, congestive heart failure, and atrioventricular blockage. For the central nervous system, clonidine causes anxiety, hallucination, depression, and also sleep disorders. This is because of the decreased central sympathetic outflow. And lastly, the effect towards the gastrointestinal tract is the abdominal pain and constipation. This is due to the fluid retention caused by the action of clonidine.
Clonidine is a class of medication called centrally acting alpha agonist hypotensive agent. It is good in treating high blood pressure by lowering heart rate and relaxing blood vessels, so the blood flow more easily through the body. Clonidine comes in oral tablet as well as extended release long-acting tablet. The onset of action is 15 to 30 minutes, so it's good to be used for hypotensive urgency. The duration of effect approximately 2 to 8 hours. Clonidine not so good for patients who are intolerant to hypertensive oral tablet. Hypertension during pregnancy is normal. Clonidine can be used in lowering the blood pressure, since clonidine primarily excreted unchanged in urine. However, clonidine not suitable for lactation mother. Clonidine excreted into human milk. This will affect the baby and lead to fatality. Clonidine oral tablet can interact with other medicine, herbs, as well as vitamin. When clonidine combined with blood pressure drug as well as drug related to the heart, it will lower the blood pressure too much, so it will increase the risk of pass out. Example of blood pressure drug and drug related to the heart are losartan, enalapril, furosemide, digoxin, beta blocker, and calcium channel blocker. In conclusion, clonidine is a good choice for effective hypertensive drug since its action good in lowering the blood pressure. However, consumption of clonidine in pregnant women, lactation, adults over 60 years old, and patients who are taking combination drug need to be monitored since it may affect the efficacy, potency, as well as the toxicity of the drug.